Good afternoon. Welcome to another Facebook live session by SpeakingTree.in. My name is Ishita and today we're going to talk about something that concerns all of us. Do you know that heart disease is the leading cause of death in India, killing 1.7 million Indians each year, according to the Global Burden of Disease report? Not only this, more than a quarter of all deaths in India are caused by cardiovascular diseases, which is mostly affecting the rural populations and young adults, according to a new study. And since it is World Heart Day tomorrow, we have Dr. DK Jhamb live with us today. Dr. DK Jhamb is Director and HOD Cardiology, Paras Hospitals, Gurgaon, and has an extensive experience in handling critical cardiac cases and a cumulative experience of performing more than 20,000 independent PTCAs, 2,000 peripheral angioplasties, and about 40,000 coronary angiographies, and about 2,000 pacemaker implants. And today he's going to really bust some myths about heart disease, because obviously there are a lot of myths that surround heart disease. Welcome to SpeakingTree.in, Dr. Jhamb. Dr. Jhamb, of course, before we begin, please write in with your questions in the comments section and we'll try and take them all. Dr. Jhamb, let's really start off by talking that, there's just this misconception that if you're young and if you're healthy, you will not have heart disease. So if you can just throw some light on that you can have heart disease at any age, though of course the chances are less, but if you can just throw some light on that.
First of all, let me thank you, Ishita, and let me thank Times Internet Services to invite me here to be able to talk to you live on this session just before the World Heart Day tomorrow. And as she very rightly pointed out, heart disease is a very big killer. In fact, so far, it is a bigger killer than cancers also. And 1 in 10 people are affected by heart disease in the country. The prevalence of hypertension, of diabetes, coronary artery disease is as high as 7 to 10% in the adult population. So there are a lot of myths which roam around concerning heart disease, and let me see if I can bust, as you pointed out, these one by one as we go on for them.
Okay. So doctor, what age to really, should we start taking care of it? Because a lot of people think that, till 40s probably we are safe, we will not get heart disease. So, is there something called too young for heart disease?
Correct. Now that's a very important thing. Nobody is too young for heart disease. Scientifically, it is said that from the age of 7 years, the plaque formation or atheroma deposit or atherosclerosis in the arteries related to the heart and the circulatory system actually starts occurring. Now that is too early, but one should be careful of all the risk factors which pertain to heart disease. And we are now seeing patients as early as the age of 20 to 30 years in the hospital with acute heart attacks. And 40 is actually too late, but one should be prepared to prevent oneself from heart disease as early as his later teens onwards.
Right. Doctor, very good input that probably late teens or early 20s one should really start taking care. Another myth, doctor, is that high blood pressure, which is a major precursor of heart disease, always comes with warning signs. But what if there are no warning signs and you suffer from high BP and people think that, oh, my BP is fine, I will not get heart disease ever in life. So what are the signs, even if you don't have any signs, what should really one do?
Blood pressure always comes up with some sign or symptom. Sometimes it's so subtle that people miss it out. And the commonest symptom is a feeling of weakness, lethargy, and headache, heaviness in the head, heaviness in the eyes by the evening time, and not being able to concentrate in work.
Right.
After that, the other symptoms related to chest pain, breathlessness also appear.
Right. Of course, please write in with the questions, doctor. A lot of people in your personal, experience also, you meet a lot of people who've had heart disease and they're very scared. they will not jog, they'll always think that, okay, I have to rest because I'm a heart patient. So that also I think is a myth that needs to be busted, that you need to get in a certain kind of activity after you've either had a heart attack or probably even angina or things like that. So what do you suggest as a doctor, that maybe after a heart condition, what really can one do when it comes to physical activities?
Well, after the heart condition has been diagnosed, then the best is to take the treatment for it. And once treatment has been taken, then one should be active. One has to get back into life with full force. If one is lying idle, not exercising regularly, then it would add to more serious problems later on.
Right. Of course, please write in with your questions. And Doctor, another myth that we've come across is that you won't be able to prevent heart disease if it's hereditary. As in, you will contract it at some point in time if your father had or if your mother has. Is it true? I mean, you will get it, or is it a chance that the parents do not pass it to their children, and the children actually, I mean, they're fine, they don't get heart disease?
Sometimes heart disease is genetic and hereditary, and that is mainly related to the incidence of dyslipidemias.
Okay.
That means some kind of an abnormality in the blood which causes the lipids to be high. And there are certain familial tendencies whereby people could be diabetic or maybe more prone to hypertension, which are risk factors for the heart disease. So that is how it tends to run in the family.
Right. And doctor, you of course mentioned diabetes, and also I read somewhere that if you're regular with your diabetes medication, there are less chances of you having heart disease. Is that true, or you can still have it if your diabetes is under control?
Well, if diabetes is under control, that takes care of a major risk factor. But then the other risk factors related to blood pressure, raised cholesterol levels, less exercise, physical stamina being less, are other risk factors which need to be taken care of.
Right. And of course, we've started getting questions. Doctor, Shilpi wants to know, do women have different heart attack symptoms than men? And if yes, what are they?
Well, that's a very important question. And women do have very different symptoms in comparison to men. Right. They may not have classical symptoms of chest pain or breathlessness or the effort-induced symptoms. And they may have atypical pain either in the arm or in the chest, or they may have sometimes just nausea and feeling of weakness, fatigue. And these women do require an investigation in terms of a treadmill test or an echocardiogram.
Doctor, of course, another thing that we've heard, random heartbeat variations, So, random heartbeat variations, once your heart, there's a random heart variation, beating fast, beating slow. They are not always signs of heart attack, are they? I mean, what really could be other reasons for an irregular heartbeat, so to say?
Well, there could be other reasons. There could be sometimes people with what we call as supraventricular tachycardia.
Okay.
And in that, there is no reason why the person should get a heart attack. But there are various other illnesses related to the heart other than the heart attacks, right, or the coronary disease that we know about.
Of course, Dr. Avantika wants to know, do yoga and meditation practices reduce the risk of heart problems apart from regular physical exercises? What about yoga and meditation?
Well, yoga and meditation actually helps to reduce the incidence of heart disease because it reduces the heart rate, it helps lower the blood pressure, and it also helps control sugar, lipids, and takes care of most of the risk factors related to the heart.
Right. Right, of course, doctor, also one of the major, precursors of heart disease we all know is smoking. So, of course, we all know this, so sooner you quit, the less your chances are of contracting heart disease. But there's also, is it also true that smoker will get heart disease, no matter at what age he or she quits. It's been some couple of years. I mean, of course, they're at a higher chance, but is it possible that you can absolutely be clean and, your lungs actually clean out themselves and you will not get heart disease?
Well, smokers are always more prone to heart attacks, but non-smokers with risk factors also are prone to heart attacks. And so if somebody has a clean lung, has never smoked and has not been subjected to air pollution much, he stands a better chance, but he must also take care to prevent himself from other risk factors. Blood pressure, blood sugar, lipids, exercise, body weight. So these are some of the other risk factors.
Right. Of course, please write into the questions. Poonam wants to know what dietary changes can I make to reduce the risk of heart disease, because there's a lot of knowledge on it on the internet, and people are actually very confused what to eat and what to avoid apart from the normal, usual that we see in the internet. So what dietary changes should really one make?
Well, in terms of diet, it is important that one should have a high fiber diet.
High fiber diet, yeah.
And a high fiber diet means more of fruits, vegetables, whole grain cereals, and
right.
So that actually helps to prevent the absorption of sugar,
right,
and it keeps the glycemic control
right
well.
Yeah, please see if you can just can you check? Please see. Yeah. Okay, doctor. Another question is that what is the immediate step we can take if we suspect that someone is having an attack? What do you think that before one goes to the hospital, what is the first step that really one can take?
The first step, if somebody has an attack, is that, or if one is confident that the attack has occurred, is that one can take a tablet of Disprin. Disprin
okay.
is available with it, and it works as a blood thinner, which is what the doctor in the hospital is going to administer the first when the patient reaches there.
Yeah, and how soon should really one take? I mean,
the moment somebody has a suspicion or any symptom that probably makes him think that this is actually an attack.
Right.
That's the best time to do.
Right. And how many dosage? I mean, how many tablets do we? One, two?
One tablet of Disprin.
One tablet of Disprin is fine. Okay, doctor. Another thing, we have a question: is eating out? Eating out regularly. Of course, we all know. But how many times is it okay to eat out? Really, when it comes to if it's dangerous for heart health, how many times is eating out dangerous for heart health? Someone wants to know.
Well, I would never say that eating out is dangerous. If one can afford it and one has the time for it, one can go ahead and eat twice a day out, 30 days a month. But what is important is what he eats out there.
Yeah.
As long as he's having a balanced diet, a prudent diet, which is not full of fats, oils, butter, cream, and he's able to avoid this and take more of fruits, vegetables, legumes, nuts, oats, whole grain cereal products. Eating out would be a very good option.
So eating out responsibly, so to say.
Correct.
Exactly.
In a prudent manner.
In a prudent manner, of course, and of course not often. Of course that is there. Dr. Pallavi wants to know that a gastric attack, sometimes a gastric attack looks, feels more or less like a heart attack. Is there any way to differentiate really? Because you do get that heartburn and congestion, and you do feel weak and maybe pukish or something. So is there any way to differentiate, or do you think they're both different and people shouldn't get confused? But for a layman, for a person who's not a doctor, how do they differentiate? If they're otherwise healthy.
Heart attacks most often present as gastritis.
Okay.
And people always want to give themselves, the patient always likes to believe that he has gastritis rather than a heart attack when he's feeling such a symptom, which most often actually turns out to be a heart attack. So there is one difference between these two, and that is that if it is pure gastritis, the symptoms would be only related to the abdomen. nausea, vomit.
Okay.
Maybe there may be some loose motion or enteritis.
Right.
But if it is something to do with the heart,
Right.
then there would always be some kind of either breathlessness or feeling fatigue, tiredness. And such an individual can always get up and walk.
Right.
A brisk activity at that time will let him understand whether his symptom is because of the heart or not. If it is because of the heart, the symptom will increase. Right. And the moment he rests, the symptom will reduce again.
Right. That's a very valid point, doctor, that you've given, that in terms of a gastric attack, you can actually, if you are able to walk freely and not stopping yourself, it's probably just gas. Otherwise, you find yourself unable to do anything. Someone just asked that I'm always tired. She's not really mentioned her age. Why is this? And should I get my heart checked, or what do you think could be the reason? She's not really mentioned anything else, but just says I always feel tired.
Well, if one is always tired, chances are less that this kind of tiredness is because of the heart. The symptom related to the heart would occur on activity and disappear at rest.
Right.
But if one is always tired, one should get simple blood investigations done to look out for the thyroid hormone levels or blood sugar, lipids. Maybe the hemoglobin, if the hemoglobin is low, somebody may be anemic, pale, and that may give a feeling of being always tired.
Right.
So, and it's simple, get a complete whole body checkup, get the blood pressure tested, get an echocardiogram done, get a treadmill test. So these would easily point out if somebody who's always tired has anything to do with the heart or not.
Right. Doctor, of course, one of the biggest problems we're facing today, irrespective of where we are stressed. So if you can just shed some light on the role of stress that plays in heart disease, and really how can we prevent it?
Stress has a definite linear correlation with heart disease, and more the stress of any kind, the greater the incidence of or proneness to develop heart disease. Whether the stress is mental or emotional, it does cause this, as well as pollution. Both of these are direct risk factors for the heart disease.
Right.
But physical stress is not a contributor to heart disease.
Right.
Anybody who has to do more physical activity and is stressed out because of that does not necessarily mean that he's more prone to heart disease. Okay. Now, the emotional as well as the mental stress, if any, can be taken care of, as we pointed out before also, by simple lifestyle modification measures, following yoga, meditation, being regular in exercise, eating well, eating right, small, moderate quantities, exercising regularly, keeping away from smoke, taking time out to have a nap either in the afternoon and a good night's sleep. All of these actually help to bring down the stress.
Okay, so we don't have much time left, so please write down the questions. The Dr. Tarun wants to know, is it correct that after having the first heart attack, chances of second and the third heart attack are frequent, and how can we reduce them if we've already had, like, say, one heart attack?
I would not really agree to that.
Okay.
Most people who've had one heart attack often understand what was the cause for it, whether it was the smoke in them, or lack of physical activity, or the high blood pressure, or sugar, or the abnormal lipids. And with his investigations with the doctor, this kind of a patient would be able to understand what was the reason behind and be able to take corrective steps for it. Once corrective steps have been taken, and simple medicines like blood thinners, aspirin, statins to lower the cholesterol, once they have been initiated, then the incidence of the second, third, and the following attacks actually diminish in such individuals.
Right. Doctor, another question we have is heart disease an irreversible condition? As in, if you've had a heart disease or heart attack, will you forever remain a heart patient, or really you can go back to post heart disease days for good? I mean, live the life that you always, maybe not in the sense of eating junk food, things like that, but generally, is it an irreversible condition?
This is it would have a very variable answer. There are certain conditions of the heart where the attack has occurred. We call it heart attack. Once it has occurred, the ECG changes would be irreversible.
Right.
But the damages because of the blocked artery could be reversed by measures like the balloon angioplasty, stent, bypass surgery, and medication. So, if one considers the stigma of the ECG change or the event of the attack which has occurred, well, then maybe one can say that this is irreversible. But all the negative effects because of it are all reversible. And one should have a very positive attitude on this. Once the attack has occurred, or angina has started, or disease has started, and proper remedial action has been taken, angioplasty has been done, treatment has been initiated, then those who are positive in approach are not too bogged down or worried about it are the ones who actually succeed and have seen probably live longer, better, healthier than the other individuals who never experienced such a symptom and always live in the fear of having an attack.
Right. Doctor, as a last questions, could you just share some tips? It could be in terms of the food you eat, or in the terms of the exercise that you do, that can really prevent heart disease. And from your experience, you think work best for people who are prone, who are not prone, everyone. Just say 2-3 tips that to just wind this up.
Well, the most important thing is to look out for the risk factors. Now, there are some risk factors which are non-modifiable, like gender, age. As we increase in age, one is more prone to the attack. But then there are others. Blood pressure. One should always try and watch out for it. Keep the blood pressure under good control, below 140/90 millimeters of mercury, either with or without medication. And blood sugar. The fasting should be below 100 milligram percent, and 2 hours after a meal it should be below 140 milligram percent. The lipids and the bad cholesterol, or the LDL, should ideally be below 100 milligram percent, preferably below 80 milligram percent. The more one exercises, the good cholesterol or the HDL improves. So these are the blood parameters. Other than this, taking care of body weight, eating healthy, eating right, eating in small, moderate quantities, being regular with exercise, as well as making a day's schedule in such a manner that it includes exercise, a short time for yoga, and maybe meditation also would help keep the individual healthy. And most important of all of these is keep away from smoke as well as smokers.
Of course, because passive smoking is equally harmful. Yes, of course, we all know that. Thank you so much, Dr. Jhamb. And as Dr. Jhamb rightly said, and he's given us some great inputs, please take care of your heart. It's World Heart Day tomorrow. Please spread the message of heart health, and keep yourself and your family members safe always. Thank you again, Dr. Jhamb. It was a pleasure having you. That's all we have for today. We'll be back soon with another session on Speaking Tree Live. For your daily dose of spirituality, please keep logging to Speaking Tree. Thank you so much.